I think in order to have the conversation about learning disabilities, it's really important to understand what learning disability is. Although learning disability is the most common disability visible in educational settings, there are different understandings of the disability, different diagnostic criteria. So I think it's really important for us to understand that. There are two pathways how someone could get diagnosis. One could be through medical diagnosis, going through a psychologist, usually, and those diagnoses are conducted via DSM-5 criteria guidebook. The most common, I would say, diagnoses are coming from educational settings. So children are diagnosed in schools, either elementary school or high school, and those diagnostic criteria are guided by federal law, which is IDEA 2004, revised in 2004. Even though they are diagnosing the same disability, the diagnostic criteria are a little bit different, and I will go over the differences. The first difference comes in the name itself. The medical diagnosis under DSM-5 calls this disorder as specific learning disorder, where the educational criteria calls it specific learning disability. So right there in names, we already see the differences. The way DSM-5 is describing learning disorder is as neurodevelopmental disorder of biological origin. So something that we have from really early on, from when we are born. And it's manifested in learning difficulties and problems in acquiring academic skills. So kind of very vague. And how it's manifesting itself, it's manifested to a marked degree that the achievement is below age or below grade level. We need to have evidence of at least 6 months of the disability. Usually we see it longer, but that's the qualifier. And exclusionary criteria involves that this difficulty is not related to intellectual disabilities, developmental disorders, or neurological or motor disorders. So there are some exclusionary criteria. So once a child or a person qualifies for specific learning disorder, it has to be specified in what area. It could be either with impairment in reading, with impairment in written expression, or impairment in mathematics. So these are the qualifiers. And this is the most recent criteria as of few months ago, because that's when the DSM-5 was revised. Before, learning disability had a little bit different definition. If someone is not diagnosed outside of school setting, they are usually diagnosed within school environment. And schools have its own set of criteria, and the way disability is described under IDEA as disorder in one or more basic psychological processes. And here is kind of the difference in understanding or using language. It could be spoken language or it could be written language that may manifest itself in the imperfect ability to all those little areas that are marked in red. So ability to listen, think, speak, read, write, spell, or to do mathematical calculations. So as you see, this definition is much more specific. What could be included in this specific learning disability, condition as perceptual disabilities, brain injury, minimal brain dysfunction, dyslexia, developmental aphasia, they all could go under the category of specific learning disability. This category also has its exclusionary criteria, somewhat similar to the previous definition, but more expanded. So a child cannot be diagnosed with specific learning disabilities if those learning problems are primarily result of visual, hearing, motor disabilities, intellectual disability, emotional disturbance, or environmental, cultural, or economic disadvantages. I know that the last two or three are very difficult for schools to exclude, but we want to make sure, the definition wants to make sure that a child who's not achieving in school at his grade level is not diagnosed with learning disability where the basis for the lack of achievement could be due to other factors. There have been also changes in the school diagnostic criteria. Initially, for many, many decades, the way someone was identified for learning disability is by measuring the person's potential, cognitive potential through IQ tests, measuring their achievement abilities, and then seeing if there is discrepancy. So as you see the bell curve, each section between the dotted lines indicates one standard deviation. Anything within one standard deviation, it's average, we don't need to worry about. And if both of these tests had results within one standard deviations, there is nothing to worry about. However, if the discrepancy between achievement and cognition was over one standard deviation, that the child, the person, could qualify for specific learning disabilities. And although it seems okay, there were occasional problems because a child could be above average. They could have IQ of 130. They could have achievement of 100, which is solid average, but the discrepancy is about 2-3 standard deviations, and this child would qualify for specific learning disabilities. On the other hand, we could have a child who has IQ of 85. They could have achievement of 88. And because there is not enough discrepancy, there's not even one standard deviation discrepancy, these children would not qualify for supports under special education, and they possibly would require that. So that was one of the major reasons why it was looked into the diagnostic criteria and trying to improve the diagnostic approaches. And the new improved approach is diagnosis under RTI framework, a response to intervention framework. And what we are looking here for, we are looking into problem solving. If someone is not achieving, we identify the problem, we develop a plan, we support the child, we see if the child is responding to the intervention. If the child is responding to intervention, they staying within regular education classroom, and this is the darkest bottom of the triangle. If the child is not responding to the intervention, then the child moves into more intense supports, which would be the middle of the triangle, something that in school we call tier 2, or even to tier 3, most intense supports. So if the child needs this type of supports, there is an understanding that the child is not making the progress because of some disabling condition, and that's how the student can qualify for specific learning disabilities. So in the RTI framework, we look at the differences in achievement between the child and his peers, where the old model was looking at the difference within the child, so between his achievement and his cognition. So these are the major differences. Once we know that a child has diagnosed disabilities, we of course do that because we want to support them. In school settings, we need to support them through more structured approaches. And the most common structured approaches are either special education, through IEP, Individualized Educational Plan, or through a 504 plan. And when is one better than the other, it really depends on the child's needs. The qualifier for special education is that the disability adversely affects the child's performance. Where for 504, where we see substantially limited functioning of the person due to the disabilities. Usually, a child who needs lesser level of support is supported under 504, and a child who needs more intense level of support is supported via special education. And now my colleague, Dr. Brown, will go over into understanding the different characteristics of special education and how they impact the child's performance and how they are visible in their functioning.